check client care plan and doctor's orders. I will perform hand hygiene, gather my equipment. I'm going to introduce myself, Jolyn. Hi, my name's Regina. I'll be your student nurse today. Can you please tell me your name and date of birth? Okay, Conrad 212. All right, and then provide privacy. So then I'm going to raise the bed to working height. Head looks good. Your head looks good. And then I'm going to assess the need for suctioning. I'm looking for secretions, vomitus, gastrous secretions, rolling, and unproductive cough. And then I'm going to check vital signs. I'm going to assess lung sounds. And I would also check for respiratory rate and rhythm and heart rate. And pulse oximeter to check for his oxygen saturation before, during, and after. And then I'm gonna put this on hand per corner. And I would try 100% oxygen. And then I'm gonna put on my protective equipment first. Before all this. Okay, so I'm going to put on my protective equipment. Okay. And then I'm going to assess for rhythm and rate, pulse oximeter, before, during, and after. And I'm going to put 100% oxygen. For 1 to 2 minutes. Okay. Okay. Then I'm going to open my suctioning equipment. I'm going to add water. I'm going to check the expiration date. If it's open, so dump a little out. Pour some in here. I'm going to check the suctioning, turn it on to 80 to 120. So okay. Put that there. Then I'm gonna put on my sterile gloves. Okay. I'm gonna use my non-dominant hand to attach the suctioning. And I'm going to take the oxygen am going to check the suctioning, and I would measure the tracheostomy to determine the length of suctioning, and I will check the O2 rate, and I would suction for intermittently 10 to 15 seconds, allowing oxygen, and I would check any secretions, the amount, clarity, and I would clean it in between each assessment, and I would check for respiratory rate and O2, and I would do this for a maximum of 3 minutes, 3 times, and with a minute in between each suctioning. So this seems good. And then I'm going to guard. I'm gonna put that here. I'm going to check lung sounds to make sure they're clear. Okay, sounds clear.
Raise it up to working level.
I will discard of my equipment.
Now I'm gonna lower the side row.
Make sure the oxygen's on. And dispose of my
And raise the head of the bed.
And then I'm going to discard of these gloves before I open my tracheostomy kit. Perform hand hygiene. Now I'm sticky. Then open my kit. I'm going to
Now I'm gonna take vital signs. And this is it. Gonna
Place that
include
there.
respiration rate,
my broke stereo.
pattern, and O2
I'm
saturation.
going to grab my gloves. Put that there.
Now I'm gonna check double
And
consciousness.
would again add water,
Increase the key.
checking the expiration rate. Should have left it open. Okay.
By my assessment, patient is going to suction. So I'm gonna put on my PPE.
Okay. Damn it. My bad. Okay, I put my non-sterile gloves on. I am going to take the fenestrated dressing and dispose of it. Take the inner cannula out. Add it in the water. Dispose of my non-sterile gloves. Perform hand hygiene.
Okay.
And then
So
put
I'm
on
going to now take
sterile
suction.
gloves.
Should be 80 to 120. Going to remove the water container. And pour it in.
Okay. I'm going to set up my dressing. Okay. I'm going to add this in the non-sterile. I'm going to clean the plate.
I'm going to put on oxygen for 1 to 2 minutes.
I should have got another one. Okay, and then I'm going to clean the
100%, which is at 15 liters.
scrub the outside, make sure to get all this dried secretions out. Also,
Put on
that's
sterile.
breaking sterile. Going to inside. And then I'm going to dry it. So I'm gonna grab a 4x4
Okay.
and make sure to dry it thoroughly.
Catherine. With a non-sterile hand, I'm going to apply to the distal.
I am going to grab it by the flange and insert it into the,
Check oxygen levels before, during, or after.
and then I will clean the insertion site.
So starting with removed oxygen delivery device.
Okay.
Then I would replace the fenestrated dressing. Holding this plate secure. And I would check the tracheostomy ties, make sure they're clean. If they needed to be changed, I would change it. Apply the oxygen. Check his O2 rate.
3. Yep.
Okay.
And
Now I'm
then
going to remove oxygen device.
I'm going to assess lung sounds.
Going to test out my suction and using water. Okay. Now we're going to determine the length of the inner cannula. This much.
Okay.
Now I'm going
Sounds
to insert
clear.
suction.
I'm gonna
Do this for
start
10 or
this.
15 seconds.
I'm gonna lower the bed to a comfortable.
Okay.
Make sure my patient is comfortable. Put on the oxygen. Make sure his saturation is good.
Assess respiration rate, heart rate, respiration pattern,
And then I would
Oxygen
dispose of
saturation.
my equipment.
allow 1 minute of deep breathing. We're going to assess secretions, capillary secretions, and we're also going to rinse catheter. This can be done up to 3 times, depending on hospital policy, and 8 more secretions.
Oh shit.
Okay.
Take my glasses. And I would take off my mask, perform hand hygiene.
After I'm done
And I would
with
document
suction,
the
going to rinse
procedure,
catheter.
the secretions, quantity, color,
Okay.
and then I
Need
would
to turn off
document the
suction.
patient's vital signs, respiration rate, heart rate, and how the client tolerated the procedure.